Okay, this video is called Why Do People Die? And first I have a picture here of Edgar Allan Poe, the great American poet of the 1800s. And it's very sad, but almost all the women in his family died from tuberculosis. Okay, so he was a really sad life. He was brokenhearted. His wife died, his mother died. Okay. Another lady he was in love with died of tuberculosis. Now here is Charlotte Bronte, and the Bronte family. Almost everybody in their family died from tuberculosis. Two younger siblings died from TB. A brother died from TB. Two of the three Bronte novelist sisters all died from tuberculosis. So the point I'm making is back in the 1800s and before that, people mostly died of infections. Okay, a lot of women died in childbirth. If you went to a cemetery in the Victorian age, you would see all these young women dead from childbirth. Also, a woman's insurance premiums were higher when she was in her 20s and 30s than when she was postmenopausal back in the 1800s because she's more likely to die from childbirth. Okay, a lot of other infections that killed people in the 1800s were syphilis. Franz Schubert, the great German composer, Friedrich Nietzsche, the homosexual German philosopher, Oscar Wilde, the Irish philosopher, writer, playwright, Guy de Maupassant, the French guy. A lot of these guys are going to prostitutes, okay? A lot of them are homosexual. That'll increase the risk of all these sexually transmitted diseases. But still, people were dying commonly from syphilis and from other infections. They didn't have any good antibiotics back in those days. Al Capone, possibly Howard Hughes, etc. A lot of people died from dysentery, bacterial or amoebic, with bloody diarrhea, abdominal pain, cholera, sort of a more watery diarrhea, Vibrio cholera, the bacteria causing that. Other infections, including endocarditis, rheumatic fever. A lot of people just starved to death. Back in the Victorian age, in England, a woman who was married having kids, she'd have 10 or 15 kids. So, some of the kids died for whatever the reason, infections during their neonatal time, infancy, but lots of people were real poor and just died of starvation. A lot of people were exposed to real toxic chemicals with the ramping up of the Industrial Revolution, like the chimney sweep boys, cleaning the chimneys, the coal miners, or other toxic chemicals. A lot of people died in wars. Anyway, so the point was, before 1900, a lot of these deaths were random and they were infections. Nowadays, in 2000s, we can easily prevent most deaths from infection. Not all of them, but most of them. Okay? And so now, what do people die of nowadays? In the movies, people die from bleeding, blood on the carpet, okay? Big drama. But in real life, almost everybody dies from clotting. Okay? So clotting is what you want to be afraid of. If you looked at deaths, it depends on the statistics, but in the ballpark in the Western world, USA, around 30% dead from a heart attack. Next most common listed in these charts would probably be cancer, about 25% of deaths. But when you talk about a heart attack, what you're talking about is coronary artery disease, coronary artery atherosclerosis. And the same thing causes atrial fibrillation, congestive heart failure, and it's related to aortic valve disease. Valve disease is more complicated, but it's related. So these are all food diseases. You could prevent them almost always, food diseases. Okay? And we've got antibiotics to prevent most of the stuff that happened before 1900. And what you're going to see is most of the stuff that happened after 1900 is just a food disease that you can avoid. So the point is you can avoid most common causes of death. That's great news. Cancer is most often due to ischemia, lack of blood flow. Okay, atherosclerosis is a blood clot. I've talked about that extensively in my lectures on atherosclerosis. So anything that makes a blood clot increases your risk of atherosclerosis, which means high-fat diets. It means anything that causes leaky gut, because that's going to lead to postprandial endotoxemia, the bacterial endotoxins getting into the blood, and they cause the blood to clot. They cause an amyloid transformation, change in shape of fibrinogen, the clotting protein, so it's more prone to forming clots. It goes from alpha helix cylindrical to beta pleated sheet, forms these aggregates, amyloid clots, and that's good to know. So you don't want leaky gut. How do you avoid leaky gut? Eat a high fiber diet of whole foods and avoid anything toxic to the gut. Reverse osmosis, filter your water. Okay, I also wrote in here for cancer, hot disease, cold disease. So basically when you get tissue hypoxia, lack of oxygen, the mitochondria can't function normally and the cell reverts to anaerobic metabolism. When it reverts to anaerobic metabolism, that can simultaneously activate growth pathways called the Warburg effect and lead to cancer. So mitochondrial inhibitors also increase the risk of cancer. So you don't want that. I made a list. I'm the one who figured out like over 120 causes of mitochondrial inhibition. And I've given lectures on that on my own channel. I got a playlist on that. I got a good lecture on that over at VegSource. You just look at the list and you avoid them. A lot of them are super common. Tylenol, statins, metformin, selective serotonin reuptake inhibitors, tricyclic antidepressants, fluoride, glyphosate, atrazine, cadmium, aluminum, most antibiotics, fungal inhibitors, succinate dehydrogenase inhibitors, which means most preservatives on processed food, for example. Okay, next is dementia and stroke. When you're demented, you're basically almost like being dead. You've lost your ability to remember, to enjoy life, to participate in life. Lots of strokes are small, but you can have big strokes that cause a patient to be mildly demented. Again, these are primarily food diseases. I got the best theory in the world, the supply and demand theory about dementia, so you can watch all my lectures on that. But you basically look at the list. I figured out about 200 things that cause cognitive decline. You just avoid them. Again, what's the most important thing? Eat a low-fat, plant-based diet with no oil, organic only. You got to watch out for antihypertensive medicines because the hypertensive medications, they drop the pressure. Well, if you drop the pressure, you might drop blood flow to the brain. It's a very common reason why old people fall because they took too much antihypertensive medication, drop the pressure of their brain, they fall. Okay, tamsulosin, the prostate drug for people with BPH, benign prostatic hypertrophy, difficulty urinating, LUTS, lower urinary tract symptoms. That can drop their pressure too. It's an alpha blocker, meaning it's a vasodilator. So you don't want that. Be careful. Almost all the patients over 50, they're going to have hypertension typically, and very often they're diabetic or at least pre-diabetic. Routinely, they got fatty liver. And that's all. Hypertension and diabetes cause increased risk of blood clotting. So they cause atherosclerosis. Same thing with psychological stress. Sleep deprivation is manifested the same way, elevated cortisol and catecholamines. So is caffeine, and drinking caffeine. You should quit the caffeine. The older you get, the more vulnerable you are to it. Same thing, causing atherosclerosis is the most common cause of damage to the kidney, hypertension and diabetes. These are food diseases. Liver failure is usually a food disease. Fatty liver progressing to non-alcoholic fatty liver, NAFL, to NASH, non-alcoholic steatohepatitis with inflammation, that progressing to cirrhosis, liver failure. Okay. Primarily food diseases. There's also some infections like hepatitis C, hepatitis B, for example. Autoimmune diseases, again, primarily food diseases. All of the most common causes of diseases of death are primarily food diseases. The other ones are irresponsible behavior. Sometimes it's just bad luck. You get in a car accident, a semi goes across midline. Okay. But most of the time it's because the person's drinking or they're out late when they shouldn't be. They're in the wrong location. Some is suicide. It's unfortunate a lot of times because of psych drugs. Smoking tobacco is completely stupid. Drinking alcohol is stupid. Opioid use is stupid. Marijuana can induce psychosis. Stupid. Don't ever smoke marijuana. It's really bad for the brain. Cocaine. All those abuse drugs. So stupid behavior can get you dead. A lot of pneumonias are end stage, superimposed on other illness like a bad stroke and whatnot in elderly people. Parkinson's disease, sometimes it's due to food, sometimes it's due to toxin. And then other infections, TB, HIV, dysentery, endocarditis. Sepsis is often a terminal event. Anyways, the point I wanted to make about this is all the old stuff, which was primarily infections, people seldom get nowadays because we got better sanitation, or we can treat it with antibiotic usually. So we kind of have gotten rid of most of the stuff that killed people before 1900. We got much better OB-GYN to deliver babies. We don't have starving people now. We got fat people. And then most of the things causing disease after 1950, for example, almost the vast majority of them are just prevented by eating a healthy diet, low-fat, plant-based diet, whole food, organic only, no oil. Filter your water, and you can avoid almost all this stuff. So the vast majority of causes of disease are avoidable. So if you're careful about all these things, you got a very good chance to live on, healthy into your 80s, maybe even 90s. So anyways, I hope you found that helpful.